Good morning. Today I'm going to cover marketing and strategy, chapter 15 of our text. Marketing is a broad approach to building exchange relationships. It's not limited to patients. It applies to all relationships. Not simply promotion. It includes all aspects of the organization's interface to the world. Markets are segmented. Segments are subgroups with similar needs. Both strategy and marketing are usually targeted to specific segments. Market managers must carefully choose who their target market is when they set out on a campaign. Licensing is fundamental. Goal is to understand the perspective of customers, associates, and suppliers. Both qualitative, verbal exchange, and quantitative survey approaches are used. Approaches are designed ad hoc. Strategies are framed using the tools of evidence-based management. A strategy is a systematic response to a specific stakeholder need. Strategies integrate the results of listening and the environmental assessment. Extensive discussions allow stakeholders to gain understanding and agreement. Senior management and governance strategic discussion and implementation. Commitment to long-term benefit for all rather than expedient gain for a few is central to success. Large healthcare systems can strengthen both commitment and the evidence-based tools more readily than the small ones can. Keywords in Chapter 15. Marketing is a deliberate effort to establish fruitful relationships with an exchange partner's stakeholders. Strategy is a systematic response to a specific stakeholder need. Segmentation is a deliberate effort to separate markets by the customer need and the message to which the markets will respond. Branding is a community-wide effort to convey mission and the competitive advantage of the organization. Reach in advertising is the estimate of the number of people who will see or hear a specific ad. Frequency in advertising is the average number of times each person is reached by a specific ad. Transaction cost is the cost of maintaining a relationship, including the cost of communication, negotiation, and so forth. Strategic position is a set of decisions about mission, ownership, scope of the activity, location, and partners that define the organization and relates it to the stakeholder needs. Purpose of marketing and strategy is to identify, evaluate, and respond to changes in stakeholder needs. A successful strategy must meet several different interrelated criteria. The services offered uses processes that are competitive on cost, amenities, and quality. Demand is adequate to cover the fixed costs and meet quality standards. The work environment attracts and retains associates who are committed to implementing the strategy. Services identify and capitalize on competitive advantage, a reason customers select them over alternatives. The constellation of services is one that attracts and builds patient and associate loyalty, and that fulfills what patients and associates can realistically expect. The 4 P's of marketing is what I'm going to cover next. Product. What exactly is the product or service offered in the exchange? Place. Where and how does the exchange take place? Price. What is the total economic value of the exchange? Promotion. Bring the opportunity to the attention of the stakeholder likely to accept it. Healthcare marketing must overcome intimate, life-shaping decisions about services which people have strong and sometimes irrational feelings. Delivery mechanisms that have high fixed costs. Providers who are divided into a large number of professions who often compete between and within their specialties. Healthcare marketing must overcome unpredictable customer expense that fall disproportionately on a few people. Health insurance that is financed largely through taxes and employer contributions. Differences of opinion among patients, buyers, providers, and society at large about what is appropriate. Convincing potential customers. Convince patients to select this provider and services. Encourage wellness and disease prevention. Adjust patient expectations about care. Next, we must improve patient communication. Messages should be carefully targeted to specific population segments where change is desired. Advanced plans for promotional campaigns should Advanced plans for promotional campaigns should specific reach, frequency, media, costs, and measures of expected outcome. Campaigns should involve community partnerships. Identify strategic opportunities. Buyers and customers. What opportunities for this measured improvement are revealed by benchmarking, quality, cost, access, and amenities? New technologies and substitutes. What opportunities exist to reduce the cost of technology, such as by substituting less expensive protocols or using less skilled people? Resource availability. What funds are available for investment in expansion or renovation? Competitor activity. What actions are competitors taking? Potential competitors and regulatory impact. What new models of healthcare delivery are being developed elsewhere? Document strategy is next. Environmental factors. These are derived from 5-year environmental assessment and identify potential directions of change for a second 5 years. Services plans. Specifies the clinical services and other activities in which the institution will engage with annual forecasts. Long-range financial plan summarizes the expected financial impact on income. Information services plan describes the future capability and hardware array of information services. Human resources plan shows the expected personnel needs, terminations, and recruitment requirements. Medical staff plan, part of the human resources plan that focuses on physician replacement and recruitment. Facilities master plan details the construction and renovation activities. Successful ACOs provide 4 critical contributions: shaping the mission values to a comprehensive stakeholder perspective and emphasizing those commitments in a day-to-day decisions. Insisting that the performance of the centralized processes be benchmarked. Last but not least, maintaining a listening and celebrative environment. Authoritarianism behavior on the part of the central managers is profoundly destructive. Maintaining a learning environment. Systems can and should focus on ongoing education for ACO leaders and trustees. This concludes Chapter 15 presentation. Thank you very much.